My current situation is that I can't open and close my mouth properly because my bite and my jaw don't align, meaning that my teeth literally don't fit together in a way that makes my jawbone move in a strange way in the socket when I close my teeth together. Um, when I try to bite, it pushes my jaw back and to one side, and it can't move properly on the disc. I get clicking and popping and cracking, and I get debilitating nerve pain and muscle spasms. My problem started about 14 years ago, and despite seeing several dentists and jaw doctors, no one had even considered that it might be my bite and my jaw. After several years, until my problems had become so bad that I had basically dropped out of university, and my life was in pieces, I eventually found a dentist with an interest in jaw problems, and they made me a splint that temporarily relieved my symptoms until they then messed it up and my symptoms came back differently. At this point, it was clear as day that my problem was my jaw. Other professionals that I've seen have varied wildly in opinion. My local dentist knows that my bite is terrible and has made several referrals to me to NHS orthodontists and jaw doctors, but none of the people I've been referred to have considered that my bite and jaw might not be aligned. They outright refuse to consider that, even when I tell them that's what I think is wrong. The private industry, which I'm basically forced to go to, have been the Wild West, frankly. Most dentists and orthodontists will deny any link between the teeth and jaw function, which is completely wrong, and will claim that they've got a lot of science backing that viewpoint. Out of the few that have acknowledged that the teeth and jaw need to align for your jaw to work properly, they all seem to have different methods of treating patients. They all have different kinds of splints or other devices that they use. They all have different amounts of time that you need to wear it, and they would each suggest that my jaw and bite were disaligned in a different direction. One person would tell me that my jaw needs to be further to the left, another might tell me that it needs to be further to the right. These aren't just differences of opinion, these are polar opposite opinions, and I think that many of the professionals are just making stuff up. My life has been torn to pieces. I have debilitating jaw pain, I get muscle spasms, and it affects my eustachian tube, which is the ear pressure tube, which is next to your jaw. I'm unable to work, I'm unable to sleep, and I'm usually unable to think properly. It's like being physically tortured. I have been to professionals desperate for their help, and they have laughed in my face, or scolded me, or tried to con me. I believe that being left with your bite and jaw misaligned like I have is frankly inhumane. It is an absolutely vital part of human existence to be able to open and close your mouth with your jaw in the right place in the socket, and that is being denied to me by negligence from the professionals.